Welcome back. When accessing sexual health care, men face challenges and lingering stigmas, but the team at Rocky Health is breaking down those barriers with discreet digital solutions that make care more accessible, judgment-free, and delivered on men's terms. Joining us this morning to discuss this are Rocky Health co-founders Dr. George Mankaryous and Aba Anton. Good morning, guys.
Good morning.
Good morning,
Rick.
I'm fantastic. How are you guys doing?
Doing well, thank you.
Excellent. Great. What are some of the biggest challenges that men face today when it comes to their sexual health?
So I think a lot of it is primarily a psychological barrier, right? I think that there's this stigma where they feel that if they're speaking, for example, about erectile dysfunction or, low sex drive, that it's associated with weakness, right? And there's also, I think men tie, masculinity with performance, right? So I think it becomes a bit of a difficult conversation to have, when there's those barriers surrounding it. And I think in addition to that, sometimes there's the worry that when they do have the conversation, it might be met with like indifference, for example, with the healthcare provider, right. Or possibly even awkwardness, right? And so it's kind of where the gap lies, right, between the need for getting help and actually seeking it.
Aba, why are men hesitant or reluctant maybe to reach out?
Well, ultimately, think of it this way, Rick. It's almost really hard to have that conversation with your partner. So imagine how hard it is to have it with your physician.
Right.
It's a difficult conversation, and in many ways, there's a self-blame that is involved where guys tend to think, it's me, I'm the problem. And they're almost worried that their partner starts to think that they're the problem, and it just starts to snowball from there. So ultimately, it's a very multifaceted issue, and as guys, we've got to get a better understanding of how to be able to find the support that we need, but also have the conversation and really destigmatize the conversation around this issue.
And that really never happens. Like, guys never have this conversation, right?
It's a very hard conversation to have even with your friends.
Right.
I think it's because masculinity, to an extent, culturally speaking, is kind of associated, with being emotionally shut down or staying silent. When in reality, the true strength comes from being able to have those conversations as they arise, rather than suffering in silence.
How is Rocky Health managing this and helping men?
Honestly, in a plethora of ways. I think first and foremost, we focus primarily on the solution versus focusing on the problem. We're providing a platform basically that offers men the ability to access it basically on their own terms in a discreet manner as well. Even down to like the packaging, for example, right? When the medications are shipped, it's all about empowering you, right? It's something that that you wouldn't be embarrassed, for example, to have like on your night table. We're kind of steering away from your traditional pill bottles that can sometimes have that stigma associated, like there's something wrong, right? And I think, most importantly, we're bringing the conversation to a place where men feel comfortable and confident, right? Which is sports, right? That's why, we're very proud to be partners with, some iconic Toronto sports teams like the Blue Jays, the Toronto Argonauts, and the Toronto Maple Leafs, right? And so when you kind of position the conversation in areas where, men feel confident in their strength, and it becomes, easier for them to come forwards with concerns that they may have.
And those kind of tie-ins, you're kind of breaking down the wall a little bit, right?
Absolutely.
Exactly. It's that feeling of being triumphant. If you recall in the movie Rocky, when he runs up the stairs and then he has that moment where he flexes.
That's the same feeling you want to provide.
That's the feeling that we're trying to capture ultimately, is that this isn't an issue where you have to be suffering at all. It's something that's easily addressable. The care is out there and it's accessible, and ultimately you can feel the best version of yourself at all times.
And all of this is online, right?
Yes.
And there's a strategy behind that.
Correct. I mean, ultimately, it's accessibility, right? When we look at data overall, 73% of Canadian millennials today prefer to seek virtual care than in person, and more than 4 million Canadians don't have a primary healthcare provider. So accessibility in general is an issue, and virtual care really solves for that problem. So for us, being able to design a platform that is seamless for patients to be able to use, to access their care, to find the right provider in the area that they're domiciled is something that we've always really focused on, and it allows us to be able to solve this problem at a scale.
Dr. Mankaryous, last word to you. We got about 30 seconds or so. Where can people begin to get that information and start on this platform?
Yeah, so the website is www.myrocky.ca. It's as simple as just creating a profile, and more importantly, just everything is laid out there to kind of see where it is that you require the most support. We have information and education on there as well, and they essentially fill in a medical questionnaire, and then we connect them with a clinician who's then able to review that and reach out and provide them with the necessary care and treatment.
Yeah, great resource, great solutions for men out there. Thanks for joining us this morning.
Thank you very much, Rick.
All the links on our website, chch.com/morninglive. Good morning.